Good morning, everybody. Thank you for joining us today. Looking forward to hearing your questions and getting some feedback from you. For today's update, we thought we would walk through some of the recent data dashboards that we posted on our website. We'll again accept your questions through the chat and answer those at the end of the presentation. Just as a reminder, we can't answer questions about specific cases in this forum, but we would encourage you to contact the Division of Family Resources on an individual basis. And with that, I will turn it over to Donna Spinner, our Director of Eligibility and Member Services for the Office of Medicaid Policy and Planning.
Thanks, Michelle. Okay, I am going to try to do this the right way so that you can see all of my screen movements. So just a reminder, that's how you get to our webpage is the in.gov/Medicaid, and then how a return to normal will impact some Indiana Medicaid members. Once you get on the site, we do have a new video here. Of course, we encourage everyone to share those. And something that I don't think we had last time we had this meeting were these three kind of hot buttons for some of our most popular items on the website. So we have where you can click here to see the CMS reports and dashboards, which we'll go to in just a moment. We've also got a new button here where you can see the FAQs. We've added some there, including some based on the feedback that we got from this last meeting. So thank you to everyone who's been submitting your questions. And then also kind of a quick link to order outreach materials. You can also do that further down on the page where you see kind of the icons that show each item. So there are a couple different ways that you can order those. Again, those will be printed and sent to you free of charge. So we encourage you to take advantage of that. But today, what we're really going to focus on is the CMS dashboards and reports page. Let me see if I can move this little slider here. So when you click this, I'm going to just pull it up on a tab just to make sure that we don't spend time waiting for, the little swirling icon that you get sometimes. So this brings up the reports that we've sent to CMS. We've got a guide to reading the baseline report, and then our baseline report, which we submitted in February before we started any of our efforts, and also our Indiana State Plan for Renewals, which was also submitted in February and is kind of an overview of how we were going to distribute the work. Our monthly reports, we've got a guide also to reading those reports here. And then we have all of the reports for March, April, May, and June. And then what we really wanted to talk about today are our dashboards. So we have developed these to show you a little more information on what's happening that you see in these CMS reports. And I can start with the April dashboard. They all have similar information, but it's based on what happened in that month. So if we pull up April's dashboard, let me increase the size here. So the first page will tell you about the total enrollment. You can see that before the public health emergency, we had a little bit of growth, but nothing like we've seen starting in March 2020. And then this shows as we grew throughout the public health emergency. And then you'll see in future months, we are starting to come down a little bit in our total enrollment. This slide shows the redetermination progress. So again, this is for redeterminations that were due in April. We had 157,688 that were due. 41% of them were renewed. As of the end of April, we had 25% that were still in process. They still have coverage while we're processing them, so we don't close them down if we've not finished them by the end of the month. Those who were determined ineligible and transferred to the marketplace, and then our procedural disenrollments, which for that month were 30%. And then we've got a breakdown over here. 5% of those procedural disenrollments provided incomplete information, or we already knew that they weren't eligible. So that would include members who were, for example, deceased, moved out of Indiana, or voluntarily withdrew. 11%, the last information that we knew on them indicated that they were probably not eligible. They were over the income limit or maybe over the age limit for their program, but they also didn't respond. So it's possible they could have sent in information that changed that, but they did not give us any new updated information. And then 15% were those who just did not respond. So we're not sure exactly what's going on with them, unfortunately. And then the next slide This is kind of a comparison of taking those procedural disenrollments and comparing them to our total enrollment by program so that you can see, are we taking actions kind of disproportionately on one group? And one thing that we've seen that's been consistent through all of the months is that if we were to say that there's a group being disproportionately disenrolled, it would be our HIP group, which are able-bodied adults. And this is kind of what we expected because a lot of these could be individuals who lost their job sometime during the pandemic and got on Medicaid. And then maybe they got the job back a few months later, but we didn't take them off of Medicaid because of those continuous coverage rules. And so now that we're looking again at their information, there are a large number of them that either look like they are over income or they may suspect that they don't qualify, and so they don't bother returning their forms. So for our age groups, you can see that the disenrollments, again, largely HIP, if we're looking at the proportions here. Our child disenrollments for April were 34%, but they make up 40% of our total population, so it was not disproportionately affecting them for April. And then what we've seen with our ethnicity and race is that it's been nothing really that's an outlier that we're concerned about, but we do have this information for you to be able to look at. And we've also got a page on the disenrollment breakdown by county. So if you serve particular counties and you want to see what is the impact of those counties that you work with, or if you want to focus your efforts on a particular county, this will give you some helpful information there. And then the last slide is our outreach efforts. So this is, it's kind of going to have two parts for each month. These first lighter blue portions are advanced outreach that we did. So those numbers won't change. This is just showing what are some of the things that we did before we even started with our return to normal processing. So we sent out 700,000 postcards and we had 211 help us, and they did 49,000 calls to our fee-for-service members to encourage them to update their contact information. And then in April itself, we sent out about 65,000 warning letters. This is the letter that goes out and says, you're going to get a mailer in a couple of weeks, and here's kind of some information on how you need to fill that out and get it back to us. We sent out 78,800 renewal packets. So those are the mailers themselves. And then once we don't receive that mailer back by the due date, we are doing the text messages go out to everyone who has a mailer due, and we did 39,000 of those, and those are kind of one per household. So if there were 3 people due, we only made 1 text. I apologize. The outbound call and the email actually go out to individuals who we sent them a mailer and the due date is passed and they have not responded. So for those, we sent out, we did 15,000 outbound calls, and then about 17,000 emails went out. So let me go back for the other months. And we'll look at May next. And so you can see for May, again, we didn't really see any drop off by the end of May. And that can be because we have, sometimes the CMS report is based on actions that we've taken, but not the effective date, which could be in the future. And we also have new applications coming in all the time. So for our enrollment data in May, we did not see any drop as of May. And then the redetermination outcomes for May, we had 165,431 that were due in May. We renewed 40% of those. As of the end of May, 28% were still being processed. Again, they're not closed. They kept their coverage while we're finishing up their processing. We had 6% that were determined ineligible, and includes those who are transferred to the marketplace. And then our procedural disenrollments were 27%, so it went down a little from the month before. And something new that we were able to find for May, we continue refining and improving what we're able to share. Of the procedural disenrollments, 32% of those members were known to have other coverage. So they may have Medicare or they may have employer-sponsored insurance. So this is just to show that not all of these individuals are left uninsured if they lose their Medicaid. And for the breakdown for our procedural disenrollments in May, 4% of them were those who either provided incomplete information or we already knew that they were not eligible. 9% looked to be ineligible based on what we knew about them, maybe their income or their assets or their age, and they also didn't respond. And then we had 14% that just did not respond. And then when we look at the demographics, again, we can see that it is mostly HIP that is being disenrolled. Again, the child disenrollments were lower than the percentage of children we have overall in Medicaid. And again, for this month, we didn't really see anything that stood out on the race and ethnicity comparisons compared to our total enrollment population. And we've also got our breakdown by county for May, for those of you who would like to use this to target your outreach or see what's going on in the counties that you serve. And then our outreach efforts in May, we sent 64,000 warning letters. There were about 75,000 renewal packets sent. We did about 35,000 text messages, and then those outbound calls that go after the due date is passed, we sent out about 18,000 of those, and then did 17,000 emails. And let me get back for June. So in the June data, you can see this is the first month where we really see it goes down a little bit. It still rounds to 2.2 million, but we did see a decrease in the June monthly enrollment report. And then our renewal outcomes for June, those renewed was 48%, which is better than both of the other months. The renewals that were still in process as of the last day of June were 30%. Again, they still have coverage. We had 3% that were determined ineligible, and that includes those sent to the marketplace. And our procedural disenrollments also went down quite a bit for June and was 19%. So the breakdown for those, again, we saw that about 30% of these members for June specifically were known to have other coverage. 2% of them were disenrolled based on incomplete information provided, or we already knew they were ineligible. 6% looked like they were ineligible and also didn't respond, and then 11% just did not respond. And then again, in our demographics, we again see that HIP is the largest program for disenrollments, and also HIP age adults, so 19 to 64 able-bodied adults are the largest group that are being disenrolled. And again, nothing really stood out in our ethnicity or race totals here. We've again got the county breakdown for you. And then for our outreach efforts in June, we sent about 54,000 warning letters, did about 76,000 renewal packets that went out, and then about 28,000 text messages. And then for the outbound calls, there were about 14,000 and about 11,000 emails went out. Let me get back here. So something else that's new since we last met is CMS has published its all-state data reporting. And so this includes, they're doing April. They will do another month as they, each month, another month will be published, but it's going to be a little bit delayed. So what they first released was for April. Not all states started in April, but for all of the states who did, they've got that data. So this is a little more apples to apples than some of the information you may be seeing from Kaiser Family Foundation or some of those other places, which are great, and we appreciate their work, but they are taking publicly available data, whereas CMS is using mandatory reporting that each state is required to send in. And so if you click on this, you will get to this page here for data reporting. And it brings up a lot of information. They tried to provide a lot of context here. So if you slide down a little, you can see pre-pandemic and pre-renewal US health coverage. They've also got information, sorry for scrolling, on before the pandemic, what happened to people who left HIP and CHIP, or sorry, Medicaid and CHIP. And then they've got some information about what their timeline will be for these releases and a snapshot of what they found for April. So I'm going to scroll back up. One thing to remember when you go here, if you want to look at the data, and you can see because I wasn't able to get rid of it, that I clicked on this. If you click on data.medicaid.gov, you are going to get a very technical page where people who are super into data can get all kinds of information. If that's what you are interested in, great, it's there for you. But it's a little bit more information and you have to kind of dig through it if you really just want to know this return to normal or unwinding data. So if that's what you want, I would suggest you come over here to the monthly data reports. And when you click on that, you're going to get this page here, which has lots of information. But really, if you scroll down here, probably what you're going to want is this Excel version of the March and April Medicaid and CHIP Consolidated Appropriation Act reporting metrics, which is a mouthful. But when you get the Excel, then you can sort and you can look at different things. I've actually already pulled that up, so I will get that for you. And I've done some of this color coding and bolding is my work, not CMS's. So when you pull up the one from CMS, it won't look exactly like this. One thing they did that was really helpful is they included a national average. So for all of the states that took actions, what were the averages of these actions? And I'm going to show you some of the ones that we're probably most interested. The percent of beneficiaries whose coverage was renewed. And this is all as a share of total beneficiaries due in the month for that state. So you can see the national average is 45.53%. We were at 41.28%, so a little lower than the national average, but not incredibly so. And then if you look at the percentage of beneficiaries renewed on an ex parte basis, this is also sometimes called auto renewal, administrative renewal. It's where we send them a letter saying, we have all the information we need on you and you've been renewed for another 12 months. You don't need to do anything unless you have changes to report. So the national average for that was 25.41%, and we were at 25.84%, so a little better than the national average. The percent of beneficiaries terminated from Medicaid and CHIP, again, as a share of all of those who were due for the month in the state. The national average was 32.26%. Indiana was at 33.6%, so not very far off of the national average on that one. And then finally, the percent of beneficiaries whose coverage was terminated for a procedural or administrative reason. National average for April was 25.59%. Indiana was at 29.74%, so a little higher than the national average, not incredibly so. And this is a metric that we've gotten better on each month. And I think, Michelle, I don't know if there's anything else that you would like to see me share.
I don't think so, Nanis. I think that covers it pretty well. You ready to go to questions then?
Sure.
Okay. It looks like we have our first one asking where we got the data on the national averages. Can you go back to that?
Yes. So the way that you get to that is you will go to our return to normal page, click here to view CMS reports and dashboards. And then once you get in here, you'll see to see data from other states, please visit the CMS data reporting page and you click here. Then you will come to this data reporting page. And this is the one where I said, you probably don't want data.medicaid.gov. What you want is these monthly data reports. Once you go to that page, it's going to, if you scroll down to the bottom, that's where you can get the Excel that I used is this first bullet right here, just the Excel version, and then you can sort it the way that you want.
Are the enrollment numbers as of the last day of the month or a different date?
So all of the actions that we take that are shown on those CMS reports, let me go back there. These reports here are as of the last day of June, what was happening. As of the last day of May, what was happening. The monthly enrollment reports that you may be familiar with that we've always published online, those are also as of the last day of the month. They're showing actual enrollment, whereas these CMS reports are showing what action did we take, even if it might have a future effective date. So there will be a little bit of a lag in our total enrollment reporting based on actions that we're taking and showing in these CMS reports.
Thanks, Nanis. Anyone can feel free to put a question in the chat right now. We are happy to take a look. We can wait a few moments to see if some more questions come in. So a person says, we had a client who lost coverage on the 2nd or 3rd of the month, but CORE stated that they were eligible on the 1st of the month, and they thought that eligibility changes only occurred on the 1st.
They should. Medicaid is what we call month pure. So except for newborns who start in the middle of a month and people who pass away and may end in the middle of a month, it should always be from the 1st through the end of the month. And if they lose coverage, it should be effective the next day of the month. That may be a question to send directly to DFR so that they could look at that particular case.
Why are there missing states in the national data?
So not every state, states had the option to start in March, April, or May, and each state kind of has a different length of time for their redetermination period. So we kind of start the ball rolling 45 days before the renewal is due. Some states do 90 days, some states do 60 days. So there's just some variation in how states are doing things. And CMS did put some data notes. Let me see if I think I probably got those here. They've got some data notes here in the last column. So for example, let's find one. Let's look at Arizona's data note. So Arizona has an R4. And if we go down to the data notes, R4, state held some or all procedural and or other terminations for the report month. So you can see there are quite a few data notes here. Every state is so different in the way that we process things that while this is the closest we have to apples, there still are some differences. So the biggest part is that most of these states probably were not taking any actions in April yet.
There's a question about what states are on hold because the process is not going well. And if we know which states those are, we do not. So no, that has not been publicly released. Nanis, there's a question about the pending renewals and the outcomes of those. Is there any data showing what percentage of the pending renewals are approved and denied in the following months? Also, is there any data showing how many disenrolled are presenting information within 90 days to be reprocessed?
We are working on getting some of that data. We do not have it currently. This has been a huge undertaking and something we've never done before. So we are working on getting some more information, but we don't have that information at this time.
Then there's a question about the provider portal being updated. We have quite a few clients who get told by an FSSA staff member that their Medicaid is reinstated, but the portal doesn't reflect it. So how often is that provider portal updated?
Yeah, that should be an overnight process. So there may be a difference, maybe if it happens on a Friday and you're looking, I don't know if they do weekend processes, but in general, it's an overnight process. So if you talk to someone at DFR on a Tuesday and they say, okay, you've been opened, the person should show as open, depending on the effective date, as of the following day in the provider portal.
Do individuals in state hospitals need to go through redetermination, or are they going to stay on Medicaid and suspended until they discharge?
We do not require redeterminations for individuals who are suspended. Once they become unsuspended, if there are items that we need to know about them, we'll reach out and ask questions, but there is not an annual renewal for someone while they're suspended.
And then there's just an additional question about our tracking of re-enrollments and if those are going to be added in an upcoming report.
Yeah, we are still looking into what we can do there.
This says the did not respond statistics. The redetermination letter instructions before April indicated not to respond if no changes occurred. Did those instructions change starting in April? And could that be the source of some missing responses?
Yeah, so there are actually two different types of mailers we send out. We've really got three buckets when you're due for renewal. The first bucket is the ex parte or auto renewal, which means we have all the information we need on you. It's recent, it's reliable. And so we tell you, congratulations, you've been approved for another year. You don't need to do anything unless you have changes to report. There's also a second bucket, which we call a May return mailer. And those are individuals where we know, all of the questions have been answered for them. It looks like they're eligible, but maybe the data we have on them is pretty old. And so for those individuals, they do get a mailer that says, here's what we know about you. Tell us if anything's changed. If nothing has changed and all of this is correct, you don't need to do anything. So we've had that for years, and we still do have those. And then the final type of mailer is what we call a must return. And those do specifically say you need to return this by this date, or you could lose your coverage. Here's some of the documentation you'll have to provide. So it's just important to look at the actual text of the mailer. If it says you don't need to do anything if there are no changes, then you don't. But if it says you need to return this by this due date, or you could be closed, those are the ones that really some action has to be taken.
Was Indiana told at any point to pause processes by CMS?
No, we were not.
Once, and I think there's some questions being asked and then answered by others, so I'm trying to keep up here and appreciate the help. Once coverage, once coverage closes, folks are not able to upload or complete the redetermination process on the benefits portal. Is this an issue that is being addressed?
Do we have someone from DFR on?
I think Katie is here.
Yeah, we will need to look into that some more.
Yeah, so if you can reach out to DFR with that question. I'm not as familiar with how the benefits portal works.
How many cases are allowed during each call to get updates on cases?
I think this is probably also a Katie question.
I'm sorry, Nanis, what?
I think that's also a Katie question.
Okay.
Did you hear that one, Katie?
Yes, it should not vary by zip code. We should be able to answer all questions and cases during the call.
When it comes, where did it go? The question jumped. When coming off of suspension, does it go back to the month suspension started, or is it the following month?
It's different for different types of suspensions. So there can't be an overlap. It normally would go forward to the first of the following month for like a state hospital suspension. For those who are incarcerated, there are some individuals that we get automatic data on, and others need to report that they've been released. And so for those who need to report they've been released, it can be contingent on when they reported it. There's a limit to how far back we'll go if there was a delay in them reporting the change.
What triggers a COVID mailer versus a redetermination?
So the COVID mailers are for our individuals who are not normally subject to redetermination. So let's say you were on pregnancy coverage, you normally don't have redeterminations. You were, at one point you were an SSI recipient, but now it looks like you're no longer an SSI recipient, or someone who was in foster care, or maybe a former foster who aged out. For those individuals, they don't normally have redeterminations, but we need to give them the opportunity to update their information with us. And so we created this special mailer that looks like a regular redetermination mailer that will go out to those groups and give them the opportunity to update their information so that they can keep their coverage. Although they will transfer to a different type of coverage. So if they were on pregnancy coverage, they may move to HIP or something like that. But it's just to give them that opportunity to keep their coverage if they qualify for some other category.
Then there's a request for Katie to repeat her answer regarding the limit of cases.
Yes, we have directive out that there is no limit of cases to rectify on a call. If there is a phone call where you're being cut off from dealing with another case, please let us know that by emailing our DFR regional mailboxes or notifying me as well.
If individuals in state hospitals are age eligible and receive a redetermination, do they need to send one in?
It depends on the type of form that they get. So you need to read the form carefully and see, does it say, if you read this, if there are no changes, you don't need to do anything. If so, they don't need to do anything unless there are changes. If that front page says you need to return information by this date or your coverage will close, then they need to respond.
Thank you, Nanis. And then there's a question and comment about instructions being passed on to the county caseworkers. We have had issues when doing in-person interviews where they have stated that they do not know what some of these new things are happening, for example, suspensions and how to correct it. Katie, can you speak to that? Thank you.
Could you elaborate on what you mean on what's not getting passed about suspensions and how to correct? Well, I hope that is a one-off situation. I'm reading your note now about the suspension of not even hearing what a suspension is. We do have, and has worked in the nursing home in the past. If you could pass on that information on the details of the case, we can certainly work with that individual and see what was going on and make sure that we have information on out there on what was causing the confusion.
And then there's a comment, thank you. It says the redetermination form gives the deadline date, but the cover letters still say if nothing has changed, do nothing. And that's creating confusion. Also, they're still seeing closure notices going out before the due date on the redetermination form.
So I'd have to look at the May return mailer, the one where you don't need to return it unless there are changes, and see it may still include a due date, just to say if you want us to update your case quickly, get it in by this time. So I can look at that. As far as the closure notices going out before the due date on the form, from my understanding of the system, I don't see how that would happen unless they returned some information very quickly and DFR was able to make a quick decision on the case. Katie, is that anything that you have heard?
I have not. So I think we would need examples of these, would you say?
Yeah. And it looks like Jenny is saying that she sent an example. So I'll look in my email and see if I can find that.
Then there's a question about the types of information recipients need to provide in response to a request for new information.
Let's see. I'm sorry, can you repeat that one, Michelle?
Yes, for sure. What are the types of information Medicaid recipients need to provide in response to a request for new information?
On the mailer itself, if they get one of those must return mailers, if they are in a category like HIP or Who's Your Health Wise, they'll need to return 30 days of income at a minimum, and then review for any other changes, sign the form, and turn it back in. For someone who is in a category that includes an asset or resource test, they would need to include their income information as well as their asset information. So probably it's going to be a bank statement from the last 30 days. And then once those are turned in, if the DFR worker sees, oh, there's something else in the case we need to know about, they'll send them a new request with 13 days to provide any additional information. And Katie, please correct me if I said any of that wrong.
There's a question, we are also seeing what appears to be multiple caseworkers on one case. For example, we have received 2 different types of notices on one case stating different items and different due dates. Will this continue or will it dwindle?
I think that one is probably also a DFR question, Katie, sorry.
Yes, and our system generates our pending verification form on what is missing in the case. So it shouldn't be different due dates and different items. So I think we would need examples of that to see what's really going on. I'm not quite sure why different dates would be populating, unless if we got something back, we had to send again because we didn't get everything that we needed. So that will sometimes happen where we do receive some things, but not everything. So we will append again, and that will have a different due date.
Thank you, Katie. When we're asking for examples from today's participants, where should we direct them to send those examples?
If there are any DFR related examples that we went through today that I said I would like examples, I'll put my email in chat right now so that you can send to me if you'd like. And Nanis may want to see was there any policy ones that you wanted to see, Nanis?
They could probably copy both of us. That's fine. We can work on it together.
And then what is the best protocol to resolve issues with the call center with a representative giving incorrect information? For example, saying that HIP coverage is retroactive 90 days, et cetera. What is the best way to go about getting that resolved?
The best way to resolve misinformation or hearing different things from different phone calls is our regional mailboxes. We do have those listed on the website, but I could maybe pull them up and drop them into chat if somebody needs them. Or maybe we can.
That's a good idea. We can also list them all or provide a link on our Return to Normal website. Provide a link to where all those email addresses are listed as well. Okay. Are there any other questions, comments, feedback? Thank you, Katie. Thanks, Nanis. Okay. Well, last call for questions then, before we conclude today's session.
I see some thank yous coming in. I just also want to thank all of you for your partnership. You can reach places that we are not able to, and your participation has been vital, and we really appreciate it.
Looks like a question did just come in. And if an individual comes in on HIP to a state hospital, should they be applied for full MD?
I am not the expert on that, Angela, so you might want to send that question to me separately through email, and I'll pull in some people who know a little bit more about that.
And then there's a question and comment about the quality control measures for the call centers and why they give out incorrect information. Katie, do you want to speak to just the ongoing training?
Yes, we do have ongoing training monthly. We do have quality assurance and quality control. We tape every conversation that comes into those call centers, and it is reviewed. And I can't honestly say why incorrect answers happen, but I mean, nobody is perfect, and unfortunately, and we do have different levels of training and age of staff, or how long they've been there, I mean. But we do want to know about any of those incorrect calls so that we can do coaching, and that's what we often do.
Thank you, Katie. All right, everybody, have a lovely day, and we look forward to joining you next time. Thank you.
Thank you.